Hi, welcome back to the Gluten Free RN podcast. I'm Nadine, the Gluten Free RN. And today, during episode 25, we're going to talk about NASH, or non-alcoholic steatohepatitis, also known as non-alcoholic fatty liver disease. Stay tuned. This is going to be a very interesting episode. Hi, and welcome back to the Gluten Free RN podcast. I'm Nadine, the Gluten Free RN. And today, during episode 25, I'm going to talk all about NASH, or non-alcoholic steatohepatitis. Hepatitis referring to the liver. As an emergency room nurse, I find this fascinating. Anything to do with the liver is amazing. And of course, I'm interested to do with any injury to the body that has to do with gluten or undiagnosed celiac disease. Because interestingly enough, when we change our diet and our lifestyle, our organs heal and they get better, hopefully. And when I say that, sometimes damage is done and we can't fix it. But ideally, we're going to be able to reverse some of the damage and or stop the progression of disease simply by changing our diet. A few years ago, while I was studying for my BSN, my Bachelor's in Science and Nursing, while I was doing some research, I came across a video conference between three pediatricians. One was on the West Coast of the United States, one was on the East Coast of the United States, and one was in Italy. All of these pediatricians were concerned about an epidemic of pediatric patients that they were finding with NASH, or non-alcoholic steatohepatitis, which was disconcerting to them because this NASH was being discovered on autopsy on children. This piqued my interest as an emergency room nurse and as a nurse in general, and certainly one that was interested in celiac disease and non-celiac gluten sensitivity. Because what they discussed was that few, if any, of these patients had any signs or symptoms, little or no pain associated with the NASH or non-alcoholic steatohepatitis. They didn't even show any liver bumps in their enzymes. And we'll go over that in a little bit. It didn't show up on ultrasounds or CT scans. So these children were showing up essentially dead on the autopsy table, and it was discovered that they had liver failure caused by a fatty liver. What was causing this? How were these kids dying? And why were they ending up with liver failure at a very young age? This is an intriguing topic because all of us have livers. All of us would like them to be very healthy. And here we have a situation where people are developing fatty livers in the absence of alcohol. So this doesn't have anything to do with people that are alcoholic and end up with cirrhosis of the liver. These are people that are dying of cirrhosis of the liver in the absence of being exposed to alcohol. Overwhelmingly, what we're finding is that this NASH, or non-alcoholic steatohepatitis, is being caused by our environmental factors that have changed over a number of years. And there are many dietary culprits. Certainly, we find NASH in patients that are overweight or obese. Up to 90% of the patients undergoing bariatric surgery have fatty liver disease. And really, the only diagnostic tool for NASH, or non-alcoholic steatohepatitis, is a liver biopsy. How many of us undergo a diagnostic liver biopsy routinely? I can assure you very few or any patients, unless they have other overwhelming signs or symptoms of liver failure. Some of the dietary culprits that have been indicated are sodas or pops, depending on where you live, fast foods, highly processed foods. Certainly alcohol has to be a contributing factor. High fructose corn syrup, nutrient-deficient carbohydrates, sugars in the form of orange juices, soda pops, any empty nutrient-deficient carbohydrate. This incorporates a lot of the standard American diet, which is also referred to as SAD, the standard American diet. And what poverty in America looks like is people eating lots of crappy foods or lots of nutrient deficient foods, but they're still obese. Let me assure you that it's not necessarily their fault that they're obese. Unfortunately, our culture, our society has set this up, and now we're having to pay the price. The obesity trends, per the CDC, say that 60% of the people in 13 states in the United States will be obese by 2030. 60% of the population in at least 13 of the United States will be obese by 2030. Obesity and poverty go hand in hand. But what do poor people eat? They typically eat the known culprits that cause NASH, non-alcoholic steatohepatitis. And the interesting thing is, I would say that starving people in the United States are primarily obese. It's not because they're eating too much nutrient-dense food, it's that they're still starving, and that fat is an opportunity or a compensation tool that their body uses to store cheap energy. So people that are obese are starving. And the simple fact that they're storing fat as cheap energy is the body's compensation tool to keep their bodies alive. They're still nutrient deficient. Their vitamin Ds are low, their B6, B12s, every nutrient value, I can assure you, is going to be low if these people actually got a nutritional panel, which typically, of course, we don't get as Americans. Very few people get a nutritional panel. And if you look on PubMed or if you do any searches on the internet, you will find that there's a significant correlation between undiagnosed celiac disease and non-alcoholic steatohepatitis. Celiac disease was found in about 10% of the patients with unexplained abnormal liver panels, and in 3.5% of these patients with NASH as the only manifestation or presentation of celiac disease. So any patient, whether it's a child or an adult or an elderly person that has a bump in their liver enzymes, typically ALT and AST, these people should be tested and screened for celiac disease and potentially given the option of going directly on a gluten-free diet. Again, because it's preventative for so many of these health issues that we talk about on the Gluten Free RN podcast. A great study out of Canada in October 2015 showed that the most common indication for liver transplant in North America and projected to be the leading cause of liver transplants by 2015 was because of the epidemic of NASH, or non-alcoholic steatohepatitis. The Canadian study identified obesity, sedentary lifestyles, highly processed foods, undiagnosed celiac disease, comorbid factor of MS, or a diagnosis of MS, and type 2 diabetes. So type 2 diabetes being hopefully diet and exercise would fix it and weight loss, and people wouldn't need medications anymore. Again, that would help with the prevention of NASH or the treatment of NASH. Because if we don't find it, if we don't identify people that are high risk for NASH or non-alcoholic steatohepatitis or fatty liver disease, these people are at risk for 1, liver failure, fibrosis, and hepatocellular carcinoma, which is cancer of the liver. Non-alcoholic fatty liver disease is defined as the accumulation or buildup of fat in the hepatocytes or liver cells, and that fat is made up of primarily triglycerides. The compelling reason why this is such a big deal is that it's largely asymptomatic, which means that people do not present with liver pain or any type of liver symptom until they have profound liver failure or profound organ failure. So they might present with jaundice or ascites, which means they have fluid in their abdomen. And at that point, the damage is done, and it's very difficult to undo that damage in the absence of a liver transplant. And it does need to be taken into account that if a fairly large component of the population is going to have NASH, who are going to be the liver transplant donors? That question has to be asked, because what they were finding in several of the studies is that the people that were screened to be liver transplant donors actually had NASH themselves. Some of the people that are at increased risk for NASH are, of course, anybody that's obese, but even in the absence of obesity, people have had NASH. So despite being fat themselves or obese, skinny people have been found to have NASH. But it has been noted to be at an increased rate in the Hispanic population, the Native American population, and pediatric population. So children are at increased risk for NASH. And that's a very concerning statistic. Scientific America noted in February 2015 that 16,000 people were on the waiting list for a liver transplant, but only about 6,000 transplants are performed each year. So that means that roughly 10,000 people did not get a liver transplant, despite the fact that they met all the criteria to be on the liver transplant list. But the fact is that NASH, or non-alcoholic steatohepatitis, or fatty liver disease, is preventable. People desperately need to be aware of this. They have the option of trying to reverse the damage, and there have been several cases of where that liver damage has been reversed. There's a case study in the European Journal of Gastroenterology and Hepatology from September 2005 entitled Sonographic Diagnosis of Celiac Disease in a Case with Suspected Acute Liver Failure by Schmidt et al. And I'll just read the abstract. It says, mild liver dysfunction occurs in patients with celiac disease frequently. So we know about this. But severe liver diseases in combination with celiac disease are rare. A 19-year-old woman was referred for evaluation for emergency liver transplantation with progressive jaundice and prolongation of prothrombin time. She had a history of non-bloody diarrhea for 3 months and weight loss of 12 kilograms. At admission, abdominal ultrasound revealed liver enlargement with increased echogenicity and marked thickening of the circular folds of the small intestine, suggestive of celiac disease. The diagnosis was confirmed by endoscopy biopsy from the second part of the duodenum. On a gluten-free diet, the patient recovered within 1 week and remained in excellent health up to the present date. Liver tests normalized within 5 months, and a repeat abdominal ultrasound after 20 months revealed a normal liver and small intestines. This case report suggests that celiac disease should be considered in patients with unexplained severe acute liver disease, and that abdominal ultrasound may be helpful to obtain the correct diagnosis. I'll follow that up by another abstract, again from the European Journal of Gastroenterology and Hepatology, dated October 2005, entitled Acute Cryptogenic Liver Failure in an Untreated Celiac Patient. A case report by Ogetti and a team of researchers. Celiac disease is an autoimmune enteropathy triggered by the ingestion of gluten in susceptible individuals. The clinical presentation of celiac disease is variable, and several extraintestinal manifestations, as well as an association with autoimmune diseases, have been described. In particular, there are many links between liver disease and celiac disease. Here we report the case of a young Caucasian woman with acute liver failure selected as a possible candidate for liver transplantation. Investigation of the patient led to the diagnosis of celiac disease. A gluten-free diet led to the reversal of this severe liver failure without the necessity for any surgical or medical treatment. So again, food was medicine. A diet change only led to the reversal of liver failure. In the Journal of Hepatology, in a great article from the Celiac Disease Center entitled Increased Risk of Non-Alcoholic Fatty Liver Disease After Diagnosis of Celiac Disease. Interestingly, the conclusion for this study showed that individuals with celiac disease are at increased risk of non-alcoholic fatty liver disease compared to the general population. Excess risks were highest in the first year after celiac disease diagnosis, but persisted through 15 years after diagnosis with celiac disease. And this is a study by Riley and team at the Celiac Disease Center at Columbia University in New York City and other researchers around the world. This article further relates this information. Celiac disease is associated with both acute and chronic liver diseases, especially autoimmune liver disease. Non-alcoholic fatty liver disease is the most common cause of chronic liver disease in children and adolescents in Western nations. It is estimated to be present in 20% of the population, and some individuals may progress to fibrosis and cirrhosis. Yet data establishing whether individuals with celiac disease may be at risk of non-alcoholic fatty liver disease are nascent. Metabolic risks, as well as those altering intestinal permeability found in celiac disease, can also be potential triggers for non-alcoholic fatty liver disease. Obesity and metabolic syndromes are accepted as major accessory complications of non-alcoholic fatty liver disease, though not all patients with non-alcoholic fatty liver disease are obese. This goes on to say that a high-fat diet and sedentary lifestyle are adaptable risks, and modifications to these can lead to improvements in non-alcoholic fatty liver disease. Although there's many other studies that show that it's not a high-fat diet, it's more the highly processed trans fats that may be the culprits in non-alcoholic fatty liver disease, highly processed foods, nutrient deficiencies, and certainly a high sugar content or high carbohydrate diet. Anytime I come across a patient that has non-alcoholic steatohepatitis, what we do is we look at the patient's diet and try to figure out where we can clean it up. So this is all about using food as medicine and replacing fats that are highly processed with grass-fed beef and olive oil, real olive oil, by the way, organic avocados, bacon fat. And when I say bacon, I mean hopefully no nitrate bacon that is very low sugar, so minimally processed foods. So ideally what we're going to do is help people lose weight. But what's a good way to do that? How do we help people lose weight? Well, it's not necessarily buying a diet plan or buying into a diet plan that still replaces crappy carbohydrates with carbohydrates. What we want to do is educate people about the value of a nutrient-dense diet and nutrient-dense foods. Make sure that these people have medical and social support, because over and over and over it's stated in multiple studies and in the media and anywhere else that you look that is very difficult or impossible, or people are resistant to changing their diet and lifestyle because it's too hard. I would argue it's really hard to have an organ transplant, that it's really hard to deal with organ failure, that it's really hard not just on the individual, but on the family, on friends, on society as a whole, to deal with people that are gravely ill or potentially dying because of a preventable organ failure. If food is medicine, food can also be poison. And we really have to be good at identifying what food is good for us as human beings or as individuals, or not good for us and potentially dangerous. Just because it's offered as food or sold as food or marketed as food does not necessarily mean that our body knows what to do with it or how to metabolize it or how to utilize it. And since our liver is a detoxing organ, it's a filter for everything that we consume, then of course over time, the foods that we consume or whatever we consume, including pharmaceuticals, potentially can damage our liver. What are other things that we need to be concerned about besides alcohol damaging our liver? Acetaminophen is known to damage livers, especially people that take too much of it over time. So Tylenol or NSAIDs, which are non-steroidal anti-inflammatories, can be very damaging to the liver. And we need to use these medications judiciously. So despite the fact that they're over the counter, that anybody can buy them, and that you certainly can buy industrial size mega bottles of acetaminophen, just because we can buy it over the counter does not mean that we should take it like candy. It's not to be taken every day for long periods of time at high doses. If you have that much pain or you have that much inflammation in your body, please try to find the source of that inflammation. What's causing that inflammation? That's the question that needs to be asked. And I don't care which itis it is, whether it's gastritis or plantar fasciitis, interstitial cystitis, blepharitis, sinusitis, pharyngitis, bronchitis, whatever that itis is, itis being inflammation, you really need to find out what the cause for that inflammation is. Because until you deal with the underlying cause, you're still going to have inflammation. And one of the goals that we have is to make sure that we are getting rid of the inflammation. And one of the ways to do that is to heal up the intestines. Hippocrates knew that all diseases start in the gut. And so it's very important that we heal up the gut, the intestines. And you cannot separate out organs. You cannot say, well, I just have gastrointestinal disorders like diarrhea or constipation. Guess what? That affects every other organ in your body. So it's very important that we identify people that potentially are going to develop NASH. And like we mentioned earlier, this is a large part of the population. There is an epidemic of non-alcoholic steatohepatitis. If it's going to be the leading cause of transplants by 2025, then we really need to pay attention to this. Are you at risk for NASH? Is your family at risk for NASH? Are you obese? Do you eat fast food? Do you drink a lot of soda? Are your food choices highly processed? Do you drink a lot of orange juice? Do you have any metabolic disorder, including type 2 diabetes? Do you have undiagnosed celiac disease? Do you have a sedentary lifestyle, which means you don't move a lot? You might sit at a desk all day or be a student in school and not run and play. We have to deal with the underlying causes of these diseases. Otherwise, they truly are going to turn into epidemics. And who's going to take care of us if everybody else is sick? I want the people of America and the world to be healthy so that we can take care of each other. I want somebody to be healthy to take care of me when I get older. So I'm counting on you to be healthy. So what else do we need? We need education of what a good whole food diet looks like. Hopefully that good whole food diet is either gluten-free and dairy-free, or at the very best, paleo, or some variation of a paleo diet, which is essentially whole food, meat and fish, nuts and seeds, fruits and vegetables. And ideally, all of that will be grass-fed beef and organic fruits and vegetables. And hopefully with support, those foods will not be more expensive than the highly processed foods that are nutrient deficient. So we really do need access to accurate nutritional information that is not influenced by politics or food corporations or agribusiness or the pharmaceutical companies. We need information that is based on whole foods, how we can help ourselves feel better and help our bodies heal so that over time we are preventing, hopefully, as much of the long-term chronic diseases that unfortunately are now epidemic, not just in the United States, but all over the world. This has been a jam-packed informational episode of the Gluten Free RN. This has been episode 25, focusing on NASH, or non-alcoholic steatohepatitis. Hopefully this has given you something to think about, because if we can prevent one person from getting liver failure, or cirrhosis, or hepatitis, or preventing one child from dying unwittingly from a very preventable disease, then I've done my job today. Help me find these people, spread the word, and come back for next episode of the Gluten Free RN podcast for more useful, timely, pertinent information. I'm Nadine Gruskowiak, the Gluten Free RN. Until next time, signing off. Here's to your health, your happiness, and your long life. Bye.